Hi, this is Dr. Brandon Erickson. I wanted to talk to you today about Tommy John surgery of the elbow to answer some common questions that we get both before and after surgery. Now, we've talked about this in the office, but I'll review it again. The Tommy John ligament, also known as the ulnar collateral ligament, is a ligament on the inside of the elbow. It helps connect that big bump on the inside of your elbow to the forearm bone just on the inside of your elbow here. And either through an acute traumatic injury or from wear and tear over time, typically in an overhead athlete, but sometimes in gymnasts or other athletes, you can tear that ligament. Now, a lot of times we'll try to manage these tears non-operatively, but in people who have either acute full thickness tears or those people who haven't done well with non-operative treatment, we will go in and sometimes fix the ligament or reconstruct it. Now, whether we fix it or reconstruct it depends on a bunch of factors: your age, your tissue quality, how long this has been bothering you, if you've had any previous surgery on the elbow, and a lot of other things. And I'll walk you through both of the different rehabs today so that you have an idea of what to expect. Now, surgery for this is an outpatient procedure. It takes about an hour to an hour and a half to perform the surgery, depending on if we do a repair or a reconstruction. The reconstruction takes slightly longer because we have to harvest a graft to remake that ligament from. In a repair, we're just repairing the ligament back to where it belongs and using a very high tensile internal brace, as we call it, to help augment that repair. But when we do our reconstruction, we have to use a graft. And the graft that we typically use is what's called your palmaris longus tendon, which is on your forearm. Now, some people have that and some people don't. And the people who don't have that tendon will use a hamstring tendon, either from the same leg or the opposite leg, depending on your preference. And we'll discuss this in the office. Now, again, as I mentioned, surgery takes about an hour to an hour and a half, and we go in and either repair that ligament or reconstruct it. The way we repair it is we put some suture anchors into the bone, and then we run some sutures through that ligament and tack it back down to the bone. And we also run a very thick tape behind the ligament to almost give it a backstop to take some stress off of the ligament. With the reconstruction, we drill a tunnel in the forearm bone here, as well as in the epicondyle bone over here, and we run the graft through the tunnel and secure it into the humeral bone here. Now, if you have some nerve symptoms preoperatively, meaning you have some numbness and tingling in your pinky and ring fingers, oftentimes we'll also decompress that nerve, and sometimes we'll move it in front of that bump on your elbow here so that you stop having those symptoms when you're throwing. Now, you'll wake up from surgery in a splint, so your arm will be in a splint that'll stay on for a week. I'll see you back in the office in a week. We'll get the splint off, and we'll get you into a hinged elbow brace, and we'll start moving the elbow. Now, there's some parameters that I said as far as range of motion goes, and you're going to get a whole long protocol on how to get your motion back in the elbow with the goal of getting your full motion back by the 5 to 6 week mark in therapy. Now, the incision on the inside of the elbow here is covered with a waterproof bandage at first. That comes off, and after I see you in the office, you can shower normally with that on. Then we get you into physical therapy. And the phases of physical therapy really involve getting your motion back, then starting some gentle strengthening, and then starting a return to throwing program. Now, if you had the UCL repair, we can start throwing around the 3-month mark, give or take. If you had the reconstruction, usually we wait until the 4.5 month mark before you have you start throwing a baseball. And you'll progress through your throwing progression over the course of several months. Now, with the repair, I'd like to get you back to full competition throwing sometime around 6 to 8 months. With a reconstruction, that usually takes more like 12 to 18 months, just because we have to give that graft time to incorporate into your body. And as you go through your throwing progression, you'll start first with just light, soft toss. You'll go long toss, lofted, then you'll go long toss on a rope, then you'll work on your flat ground work, and then you'll start throwing off of a mound. And you'll have some setbacks during the throwing progression. Almost everyone does. And it's normal to have some pain in the elbow. Now, a big dramatic increase in pain is not good, and I always want to know about that if you have that. But if the elbow feels a little sore and achy after a session or two, that's normal. We just have you back down a little bit, go back a phase in the throwing program, and then continue to progress along. Now, after surgery, immediately afterwards, we use a nerve block to help with your pain. That's going to wear off about 8 to 10 hours after surgery, and you're going to go home with a different regimen of pain medicine, including an anti-inflammatory medicine, some Tylenol, and then some narcotics. I want you to take the Tylenol and the anti-inflammatory pretty much scheduled for the first few days, and only take the narcotic medicine if you need it. You probably won't need it after the first day or two because the pain from this is usually not that bad. I don't have you do much with the arm right away. As we said, it's in a splint, and we really want to protect that repair in the first few days. Now, certainly if you have any other questions, myself, my physician's assistant are always available, and you can always feel free to reach out to us. But these are just some of the common questions that we get. Have a great day.